Hello, please subscribe and like for our channel. Thanks very much. Hello, in this question they are asking you to interpret the following, and this following is the full block count. Basically, there is a tutorial on full block count interpretation, so I'm not going to speak about it in details here. Basically, so in this case, they're telling you that you have the white blood cell count of 6,000 cells per microliter, and that white blood cell count is normal is normally between 4,000 to 10,000, so it's normal. The red blood cell, there is no need to work with the red blood cells. The hemoglobin is 7.6 grams per deciliter, meaning that there is anemia, and they have not told you the age of this patient, but since it's internal medicine, I think that it's an adult, and in adults you have severe anemia when you are less than 8 grams per deciliter. So in this case, you can only speak about severe anemia. Mild, moderate anemia is in the case of 8 to 10 grams per deciliter. Mild anemia is between 10 to 12 grams per deciliter. Is it clear? So in this case, you have severe anemia. Now, the MCV, the mean corpuscular volume, is 74 femtoliters. The mean corpuscular hemoglobin is 25. The normal mean corpuscular volume is 80 to 100. It means that there is microcytic. Mean corpuscular volume tells you the size, so it's microcytic. Mean corpuscular hemoglobin, it is low. The normal value has to be between 27 to 32, so it is low. So it is hypochromic. Hypochromic helps to tell you that there is a reduced coloration. Is it clear? Now, in this case, and the platelet count is normal. The normal platelet count has to be between 150,000 to 450,000. So in this case, it's normal. So in this case, they ask you what's the abnormality that is shown. The abnormality that is shown, it is a severe microcytic hypochromic anemia. Is it clear? And every time that you have microcytic and hypochromic anemia, the first thing that should come into your mind is iron deficiency anemia. What's the likely diagnosis? Iron deficiency anemia. Now, there are other reasons why you can have microcytic hypochromic anemia. Microcytic hypochromic anemia can come as a result of one. It can come as a result of a chronic infection or a chronic inflammation. Is it clear? It can come as a result of sideroblastic anemia. Is it clear? It can come as a result of chronic hemorrhage. Is it clear? It can come as well as chronic hemorrhage and all that. Is it clear? So now those are the different other etiologies that you can have in the case of microcytic hypochromic anemia. But your diagnosis here is iron deficiency anemia. So now the question number 3 is name 3 etiologies in this case. Now, the 3 etiologies in this case that you have to name is that you have in iron deficiency anemia. To know iron deficiency anemia, you speak about the iron losses, you speak about the iron metabolism, and you speak about the iron losses, iron metabolism, and you speak about iron intake. So in this case, there is low iron intake. Low iron intake, you have poor iron in the diet. That's one etiology. One etiology is low intake in poor iron in the diet. The second etiology is increased losses. Increased losses, like in the case of chronic hemorrhage. Is it clear? If you have somebody that has chronic hemorrhage, like in a case where a patient has usually menorrhagia from a urinary, a woman that has fibroid. Is it clear? So you have a patient that has chronic menorrhagia. Is it clear? So other chronic losses of urine, chronic losses of blood. Is it clear? So those are the different things that can cause microcytic hypochromic anemia. Is it clear? Now, other causes of, so those are the different causes. So 3 etiologies, they say you have one, low intake of iron in poor diet. You have hemorrhage. So you have hemorrhage, you have increased loss of iron in the case of hemorrhage. Is it clear? So those are the things that can cause you microcytic hypochromic anemia. Another etiology in the losses, so we can talk about etiology. We have under chronic hemorrhage, you can speak about a patient that has fibroids. You can speak about a patient that has a trauma with chronic hemorrhage, upper GI bleeding, and all that. Understanding. So those are how you have to visualize. And now the third part is now on a poor metabolism. Poor metabolism of iron, like in the case of hemochromatosis. Is it clear? Those patients are also going to have iron deficiency anemia because the iron cannot be mobilized inside the body. We have also the cases of malabsorption Is it clear? Poor intake. You can take the iron very well, right? But you have malabsorption. Is it clear? Malabsorption of iron that occurs. We have also the cases of in the cases of etiology of iron deficiency anemia, can the case of parasitic infection like worm infestation. Is it clear? When you have a worm infestation, it can result to an iron deficiency anemia. You have also malnutrition. Is it clear? Can result to iron deficiency anemia. All those are associated with low intake. So those are the different things that you have to note. Now we move on to the next question. Hello, purchase your book, medical book, health science book, physics book, computer science book, all from us on 652-659429, and please don't forget to like and subscribe for our two channels, Science Video Makers and SchrDbb. Let me say the number again: 65699429. That is a place where you're going to have all these books. As you can see, we have the computer science book, which is shown in this image. You can see this is all the example of the computer science book, all inside. You have all this. We have the medical book for the first year, second year, third year, all available with all the explanation and questions. We have the physical examination book with all the step-by-step physical examination. This is the workbook for medical third year. The workbook for medical third year. This is the first year workbook. This is the second year workbook. As you can see, this is the second year textbook. All this we have on the no contact 652-659429. Thanks very much.